everyone, it's Let's Car 2 Group here with another video about the COVID-19 situation in South Africa. In today's video, I would like to talk about how to interpret all those numbers that we receive from the National Department of Health on a daily basis in the Republic of South Africa. The first up is the recovery rate. So what government does is to take the total amount of cases and those that have recovered. So they'll take the recovered amounts and they'll divide it by the total cases, and it'll give you a percentage which they round off to 94% as at the 26th of May. Now this is incorrect, because what this does is to take the active cases into consideration as well. So if you have active cases, they neither passed away nor have they recovered, which means they cannot be taken into consideration when it comes to calculating the recovered rates. So the correct thing to do is to take those that have recovered and add the amount of people that have sadly passed away, and you'll come to a new grand total, and then divide the recovered amounts by this new grand total. And as at the 26th of May 2021, the real recovery rate is actually 96.5%. And by using that formula, Mpumalanga has got the highest recovery rate in the country at 98.2%. The national average is 96.54%, and 4 provinces fall below the national average. The second number that I would like to talk about is the death rate. You know, from day to day, the death rate seems to fluctuate quite a lot. So what actually happens here is that the death rates, or the amount of people that have died on a particular day, may or may not be recorded in the official records, which means that some of them might be carried over to the next day for official documentation. And that is why you have fluctuations between one day to the next when it comes to the actual death amounts. The other figure I would like to talk about is the tests conducted. Now this is just the grand total. You get 3 types of tests which can be used to determine if someone had or has COVID, but we are just produced with the daily figure. As of the 26th of May 2021, the figure was over 11.3 million. Now to give you an example, when it comes to tests carried out per million people, Denmark is number 1 at 9.1 million tests per million people, and South Africa is way down there at 120th position at 190,168 tests per million being conducted. The bad news about this is that we are being beaten by countries such as Iran, Iraq, Belarus and Palestine. The testing is also at very low levels and also very irregular, with Sundays and Mondays being the 2 days where the lowest amount of tests are conducted. Now the 3 tests are your PCR test, your LFT and your antibody. Now there's been newspaper reports, and I'll leave links for you, where these 2 tests, your PCR and LFTs, might not be 100% accurate, which means that the positive cases recorded as well as the new cases recorded might not be 100% accurate. The fourth topic I would like to talk about is data visualization. A virus is something that is very dynamic. It's not static in nature, which means that the virus does not live within the borders of a province or a region of a metro. So you'll have overlapping between neighboring towns, let's say between the Western Cape and Northern Cape, as well as between neighboring regions in the metro. So people in Debiza, there might be 200 people that have tested actively for COVID, but they might work in Kempton Park and many might work in Midrand. So therefore you cannot exclude Midrand and Kempton Park as being regions that are not under the influence of increased active cases. So is COVID, are we really under a 3rd wave of COVID? Well, let's see. The data provided by national government is still very inconclusive because of low levels of testing as well as irregular testing. We might be on an upward trend, but remember this is also due to the after effects of the holiday season we experienced, as well as a change in seasons. And what is important is to pay attention to the numbers and less attention to the percentage, because for example 2 plus 4 equals 6, which is a 200% increase, but the actual change is only 4. So please pay attention to the numbers and less attention to the percentage. That's it for now, people. Take care.